Hi, I'm Francine Lane, and here are 5 benefits to developing a global transparency policy. I've read through many transparency policies that sponsor organizations have put on the internet discussing how they will make their transparency, how they will do disclosures, publications, and things of that nature. And I will say the #1 recommendation that I have for anyone looking to update their transparency policy is to make it simple. Don't give 12 different reasons on why you may or may not make a study public. Make it clear. All studies that are done in patients will be disclosed within a certain amount of time frame, and this is where we're going to do it. It should be very simple. It shouldn't require any kind of mental gymnastics in order to figure out if this study applies and this study does not. Many sponsor organizations may outsource all or some of their disclosure operations to CROs or clinical research organizations, or they may do it to their local affiliates, and what that could result in is some inconsistency in the data that is disclosed globally for the same study. And while it's not currently being compared to a great deal, the potential for doing that in the future is certainly very great, and you don't want to say vastly different things about your study in multiple different registries. One of the reasons that it's important to keep your policy simple is that it enables the affiliates or the other people who are doing your disclosure to follow the same set of guidelines. And if those are clearly laid out in your policy, then it's that much easier to keep it consistent. Sponsors, when writing their clinical trial transparency policies, should consider efficiencies, and one of the ways to do that is to make sure that your policies are well known throughout the organization. What we hear a lot from disclosure teams is that by the time the data gets to them, study teams are less interested in disclosing. They ask many questions about why do I have to do this study and not that study, and it leads to a lot of inefficiencies and a lot of duplicative work that the disclosure teams have to do in order to get the study teams to be engaged and involved and to be able to put out a quality product that you want, because this is public information that reflects on your organization. Like any good policy that's put in place, if you can't measure how well you're doing, if you can't audit it and say that you're meeting your policy or not meeting your policy, it's probably not a well-written policy. So when you're looking at measuring things, you can say something like all clinical trials that meet these certain criteria, or this subset of trials will be done. But don't make it so vague that it's not possible to measure. We see a lot of language like as much as possible. How do you measure as much as possible? If you have to write something like that, then maybe you need to go back to the drawing board. One of the main reasons that sponsors are publishing their transparency policies is because it reflects on their reputations. Pharmaceutical companies don't necessarily have the best perception out in the public space, and one of the reasons why is because there is this feeling that they're not sharing enough about the clinical trials, and so sponsors are putting this data out. We'll share all of our clinical trial data. We'll share all of our clinical trial data that's done in patients, so that there is a level of confidence that when you get an approval for a certain product, that all of the data is available for healthcare professionals and very engaged patients to look at to see how effective and how safe the product is.